Many have dreams to be a medical professional. When choosing an institution for medical school, a lot of things matter. The quality of the academic and clinical programs, as well as the clinical experience. At Unimas, we offer that and more. A supportive culture, a vibrant community, diverse student and patient population, all set against the backdrop of Kuching and Kota Samarahan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In Unimas, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research, and practice. It views health as a complex and dynamic, and the client as a holistic individual. Students in this program learn in an environment that stimulates intellectual inquiry and creativity, which encourages them to be problem solvers and lifelong learners.
Here, we learn how to care, to serve, and to help. We went from zero to hero.
I really cannot pick a better place to learn and become a greatness. This is a place that belongs to my heart throughout my journey.
Come do research with us.
Come and join us at Unimas and realize your dreams.
Welcome and good morning to everyone. My name is Dr. Hanzali. Welcome to our Unimas 4th Health Talk Series for 2022. So firstly, I would like to thank the organizers for getting this series together and for having us here again. I would also like to thank the speakers in advance for giving the talk very early this morning, Friday morning. So the topic today is, my nose is bleeding. Should I be worried? Surely a nosebleed has affected most of us, some more than others. So before we start, I would like to inform the viewers that any questions can be typed in the Q&A chat box, and we will answer them at the end of the talk. And also to claim for the CPD points, the QR code and the Google form will be shown at the end of the talk. Okay, now, before we proceed with our talk, I would like to introduce our first speaker, Dr. Ng Boon Han Kevin. He is our lecturer here in our ENT department and a clinical specialist practicing in Sarawak General Hospital. He attained his clinical master's degree in ENT from University of Malaya. Also, he is our phase 2 academic advisor for the medical students. So with this, I hand over the floor to Dr. Kevin to start the talk. So Dr. Kevin.
Thank you, Dr. Hanzali, for the kind introduction. Just let me share my screen. Okay, hello, hi, good morning, everyone. My name is Kevin. So the topic of my talk today is epistaxis, which is, as mentioned by Dr. Hanzali, is quite common. So this is the lecture outline today. So we'll cover, number 1, what is epistaxis? Number 2, what are the causes? Number 3, how do we treat it? And number 4, should I be worried if I have epistaxis? So what is epistaxis? It just means that you're bleeding from your nose, from a nostril, or from your nasal cavity. It's fairly common. Study done in the United States occurs at least once in up to 60%, more than half of the population. And about 6% of these people will go and seek medical attention, but less than 1% will require aggressive treatment for the severe nosebleed. And it accounts for about 0.5% of all visits to the emergency department. As you can see, the data there is about 1.2 million over the course of 3 years, so about 500,000 per year. It accounts for up to a third of all ENT emergency department referrals. And it had a bimodal age distribution, meaning happens more frequently in the younger age group and the older age group. Just a brief anatomy of the nasal cavity. So the nose is divided to the nasal cavity here, and all the sinuses, as you can see. The purple one is a maxillary sinus. The one above it, the blue one, is ethmoidal sinus, and the one on the top is a frontal sinus. So all these regions are potential area of bleeding. If you can see on the right of the screen, this is your nasopharynx area, where the famous nasopharyngeal carcinoma happens. All right. One thing to note is the nose is a very vascular structure. It means that it's very richly vascularized, a lot of blood supply, both from the internal carotid artery, as you can see at the top, and the external carotid artery at the bottom, which gives a lot of branches. All right, so this is the supply of the nose at the lateral side, that means at the left or the outer part of the nose, and this for the middle part, the bony part of the nose. You can feel right at the tip of your nose here. So both is supplied by the internal carotid and your external carotid artery, which are both big vessels, which give a lot of smaller branches. So you can either bleed from the front, from the anterior part, coming out from the nostril, and also from the back. That means it will present as coughing out blood from the mouth. So anterior, bleeding out from the front is more common. Bleeding from the back, which is more serious, is less common and it's quite rare. It's about only 5% of cases. As I mentioned earlier, if it's bleeding from the anterior part, you bleed from the front of the nose. If it's from posterior, you will feel it flowing back to the throat and you will spit it out. All right, which is less common. Okay, so there are a few differences between bleeding from the anterior part and from the posterior part of the nose. As I mentioned, anterior part is more common. It's mostly from the litmus area, which we'll cover shortly. occurs mainly in the children, the younger age group, and mostly due to trauma. And the most common trauma is nose digging. The bleeding is usually mild and can be easily controlled by pressure. Postural epistaxis, on the other hand, is less common, occurs more in the elderly, normally due to hypertension or arteriosclerosis, and the bleeding tend to be quite severe, sometimes requiring hospitalization. So what are the causes? What can cause bleeding from the nose? There are many causes. Can divide it to local. Basically, a cause is due from something from the nose itself, or it can be due to a systemic cause. That means a disease elsewhere presenting as a bleeding from the nose. Or it can sometimes be idiopathic, means the cause can be found. Okay, so local causes, there are a few common local causes. So number one, as I mentioned, is trauma. Most common is fingernail trauma. Certain people, I think probably you know some of your friends or family members who like to dig the nose, the long fingernail, that itself can cause a trauma. As we discovered, as we've seen earlier, the nose is it's an area that is a lot of blood vessels, easily traumatized. It can actually just bleed from there. Other causes of trauma are from injuries, from accidents, and from just surgery from the nose. And even some patients, a violent sneeze, if you sneeze too hard, they can have bleeding as well. Possible causes number two is infections, acute cases such as sinusitis, chronic cases such as TB and atrophic rhinitis can cause bleeding from the nose as well. Number three, foreign bodies are commonly seen in kids as well. They like to put things into their ear, into the nose, so it may injure the lining of the nose and cause bleeding. Certain older patients who are immunocompromised, body is weak, can cause infection and can cause, sometimes you find even have maggots in the nose causing bleeding as well. Number four is neoplasm. Any growth or any tumor from the nose can also cause bleeding. Tumor can be benign, meaning non-cancerous, or it can be malignant or cancerous. A good example is NPC, Nasopharyngeal carcinoma. So Little's area, as I mentioned earlier, is area in front of the nose, which is one of the most common area of bleeding. It's a group, it's an area where the blood vessel group together. So there's this 4 blood vessel which meets and converge at the area, causing it to bleed easily. So the Little's area is the one pointed by the arrow here. It's the anterior part. As you can see, a lot of blood vessels meet there. So that is the area where sometimes if you dig and you rub your nose too hard, that's the area that tends to bleed. Okay? So if you can pick into your nose, this is a left nostril. You can see this is the area that we mentioned about. Right? You can actually see all the blood vessels here. And patient who has frequent nasal symptoms, running nose and nose block, these areas tend to get very dry, not moisturized. And when it's dry, it's easy for it to be traumatized and cause bleeding. All right, especially when you rub or when you dig the nose. A clearer picture on the right of the screen, you can see the very clear blood vessels here. Okay, so if a Little's area, most of the time, if there's a bleeding stops easily, one way to prevent this is to prevent nose digging. But if they do have a dry Little's area, what we can advise is to put some cream into the area of the nose to moisturize the area, all right, to prevent the bleeding episodes. Other things that can cause bleeding, as I mentioned earlier, benign tumors. This is a juvenile nasopharyngeal, a tumor that can present as profuse bleeding. Right, commonly occurs in the male population and younger male population. This will require surgery. Right. Other tumors, benign tumors, include inverted papilloma. They will present as other than nose bleeding, they will present as nose block as well. So all these signs that we should be aware of. Okay, foreign bodies, very common as well. To all your medical officers working out there, if you have a child coming in with a nose bleeding, you do an X-ray, you see this very typical, we call it very typical double sign. Double sign on the X-ray, this is quite classical for a button battery. A button battery is an emergency because it can release chemicals, cause erosion and cause infection. You can see the picture over on the right side, can even cause a perforation, cause a hole in the nasal septum. So if this does happen, child will present other than bleeding from the nose, they can have a very foul smelling nasal discharge. They might present pain as well. has to be immediately brought to the hospital, where we have to bring the child to the operating theatre to remove it and to wash the nose. All right. And these are the instruments that we use. We have a lot of many forceps, hooks, and also suctions to remove the foreign bodies. We commonly see things such as peanuts, beads, erasers, cotton inside the nose, which has to be removed. Right? Cancers, which is malignant, the most common, especially here in Sarawak, is nasopharyngeal carcinoma, which my colleague Dr. Lim will present after this. These are some of the pictures here. So those are the local causes. So what are the general causes? What are the general causes that can actually cause bleeding? Right. So anything that can cause a problem to the blood, hematologic, any problem with the kidneys and the livers, even cardiovascular diseases, because some patients take blood thinners for their heart condition, right? So they found out about almost 45% of patients hospitalized for nosebleed, they had some sort of systemic illness contributing to the nosebleed. So the most common is hypertension. They are taking some blood thinners and also underlying bleeding disorder. So we do notice a lot of patients who have undiagnosed hypertension, right? So when they reach a certain age group, they don't go for their regular checkup. They don't know, so they come into the hospital bleeding from the nose. And when we check the blood pressure, it's very high. So actually, it's a presentation of their hypertension. Okay, so this, as you can see here, there's a lot of causes of bleeding, systemic causes. As I mentioned, even liver disease, kidney disease, those on dialysis, their urea is a bit high, blood parameters is not optimized, can present as bleeding. So it's important to remember, even though it's bleeding from the nose, you must always keep at the back of our mind, the main cause could be elsewhere. Okay, so how do we treat epistaxis? Right. So when we have epistaxis, or when you approach to the doctor with epistaxis, these are the few things that we always ask. We ask for the duration. Is it a very long-standing thing, or it just happened recently? Right. Anything that preceded, whether it's after a nose digging, after a nose blowing episode, or they had some headache. So if they have a headache, history of headache, and they have some bleeding, things that are running in our mind could be whether it could be hypertension or it could be something else in the nose that we have to see. Side of bleeding, number 2, is also very important, whether it's only one side or is it bilateral. So it's always, if it's only one side that's always bleeding, then you could suspect there's something in that particular side of the nose. Is it possible, if it's okay, to estimate the blood loss as well? Is it one handkerchief? Is it one cup? And nowadays all of us have handphone. It's good to take a picture, so can at least we can help the healthcare professional to try to estimate how much blood loss has occurred. Okay, as I mentioned, the previous history of epistaxis is important. Any recent history of trauma, any accidents, any fall with the trauma to the head, it's also important in the history. Past medical history, as we covered earlier, any hypertension, any liver disease, or patient is taking any blood thinners, or any taking any traditional or any supplements out there, which can sometimes cause bleeding. Medications as well, as I mentioned, is very important to us. So physical examination, if there's bleeding, it should be treated similarly as all kinds of bleeding. We have to make sure the airway, the breathing circulation is there. If bleeding is a lot, IV granules has to be inserted, make sure the vital signs is stable. We take the necessary bloods, then we proceed with the ENT. ENT examination, even though it's just bleeding from the nose, we examine everything, the nose, throat, ear, and neck, followed by a full examination. As I mentioned earlier, the cause could be somewhere else, not only from the nose. Right? So these are some of the bloods that we take to make sure your blood levels are normal, your kidneys are doing fine, your coagulation profile is good as well. And if there is a persistent bleeding, we might have to do some imaging, a CT scan of the nose to make sure there's no growth or mass that is hiding somewhere there causing the bleeding. Okay, so the main aim, the thing to know is epistaxis or bleeding from the nose is a clinical feature of a disease. It's not a disease on its own. So there's always a cause of the nasal bleeding. So we have to examine the nose, and don't forget to examine the whole body to make sure it's not coming from elsewhere. Okay, so what to do if you have bleeding from the nose? One of the easiest and quite effective method is called the Trotter's method, as you can see here. If you notice, the patient is sitting right up. There's someone pinching the nose here and also putting ice on the forehead. If you remember in my earlier slides, I did mention the nose is an area where there's a lot of blood vessel supply, and all this blood vessel supply comes from the top part here and also from the mouth. So by putting ice on the forehead and to gargle ice water in the mouth can help to actually make the blood vessels smaller and reduce the bleeding. All right, so it's important to sit up, tilt your head slightly forward, and apply continuous pressure on the front part of the nose. Your nose will be blocked because you press it, but don't worry, just breathe through your mouth. Okay, so my beautiful nurses and my colleagues, they actually make a video earlier on this year to educate the public on what to do if you have epistaxis. So this is the first aid. Right? Okay, so just to note, when you are bleeding, you shouldn't dance first. Okay, this is just for the video.
Excuse me, miss, I-L-O-V-E-Y-O-U. You already know.
So this video is made by my nurses, Amy and also Flo, and this is Dr. Teo Liping. So as you can see again, pinch your nose, sit up straight, breathe through your mouth, ask your family or friends to put ice pack on the forehead and take ice water and gargle in the mouth. Okay? So again, just to emphasize on this position, this procedure, the place to press on the nose is not on the bony part, as you can see in this picture. This is a wrong place to press. The correct one is like this, as you can see here. It's right on the cartilage, right at the front of your nose. So your nose has to be completely occluded. All right, sit up straight. Okay, this is a correct way to press the nose. And when you compress the nose, make sure you press it for a good 5 to 10 minutes. All right, we have seen patients who just press it for like 30 seconds and let it go and press for another 30 seconds. Those will not work. Right, you have to continually compress it for a good 5 to 10 minutes together with the position sitting up and also the ice pack on the forehead and also the mouth. Most of the time, the bleeding will stop. If it doesn't, you should be on your way to the hospital. All right. So when you reach to the hospital, what can we do? So from our side, we always prepare goggles and also apron because we get sprayed with blood sometimes when patients bleed from the nose and they cough. Okay. We have a few instruments that we can help us to manage these cases better. So what you see here is a scope which will help us visualize, help us to see the nasal cavity better. All right. This picture shows that with the scope, you can actually put the scope in and can see most part of the nasal cavity. All right. So this is what we used to do last time. With the scope, the doctors will be using a direct vision to the eyes. So he can smell the patient's breath, the patient can smell his breath. So it's not very ideal, right? So nowadays we have this. We have the scope, as you can see here, and we have a monitor, which is getting better and better. So it's very, very clear. So in this picture here is our staff nurse, Muhammad Ishaduddin, and also Dr. Jasmine scoping a patient. So with this camera, with this system, we're able to try to identify where is the cause of the bleeding. If there is, we can do some intervention, we can do suction, we can take some biopsy as well. Okay, so this is a video just to show you what do we see when we put a scope into the nasal cavity. Right, so the first thing you see, and probably when you just tilt up the nose, you can see this structure here is your turbinates. It's called turbinates, which is normal. Normally, it's there for all patients. It can get bigger sometimes for patients with rhinitis. Okay, so you don't be too concerned if you look up in the mirror and you see two shiny things. shining back at you is just a nasal turbinate. Okay. So as we go in, we can see the nasal septum, which is the middle part, the bony part of the nose. And this is your nasopharynx, which is the area where potential cancer can happen. Okay. So when we do this, we check for any growth, any tumor in the nose, any ulceration, any discharge, or any bleeding point. So this gives us a good visualization of the nasal cavity to see actually where is the cause, where's the point of bleeding. Okay. Right. So if there's a bleeding that we can see, there's a few ways we can stop the bleeding. We can either use electrocautery, which is this, or we can use chemical cautery, right? You can actually see the point of bleeding. You can actually use this method to actually immediately stop the bleeding. But sometimes it's not easy because the amount is too much and you can't actually visualize the exact point. So if that happens, we have to go on to nasal packing, right? Nasal packing, these are the few instruments that we use. This is suctions, these are some nasal speculums to help us see better, right? So these are the forceps, the instrument that we use as well. So these are one of the few things that we use for nasal packing. Here, there's a few examples here. So as you can see, it's like a sponge where you actually put it into the nose, and we normally keep it there for about 1 to 2 days, right? Keep it there 1 to 2 days to actually control the bleeding first, right? So as you can see, we insert it like this, and it will end up like this, right? So we're going to put the string and tape it here. For most of these cases, we will normally admit the patient. We'll start the patient on antibiotics, right? Once we put in the sponge, you have to start the patient on antibiotics, keep the nasal packing there for a good 1 to 2 days. Once the bleeding has stopped and all, after 2 days, we remove it. The bleeding is lesser. We can actually see where is the bleeding point that we can do and treat accordingly, right? So previously as well, you tend to use a ribbon gauze, a very long gauze, and we used to lay up in the nose like this all the way up to keep it inside. Okay. So, like I mentioned earlier, we're going to start some antibiotics and keep it packed for 1 to 2 days. But what happens if it's for posterior epistaxis, right? Anterior nasal packing is good if it's bleeding from the front of the nose, where we can actually stop it. But it's bleeding from the back of the nose, as I mentioned earlier, swallowing from the back of the nose and spitting out blood. We have to do posterior packing. So posterior packing requires putting a balloon, a Foley's catheter into the tube. And as you can see here, it will plug up here to stop the bleeding from the back. And the front part, we normally put it with the anterior nasal packing, right? So during this both procedure, anterior and also posterior packing, the nose will be completely blocked. Right? So you have to breathe from the mouth. The same thing, we start on antibiotics, keep it for 1 to 2 days to see how the progression is. Once it's okay, we remove it, then we can help us to identify better where is the source of bleeding. So despite all this, despite doing the anterior packing, we do the posterior packing, if the bleeding is still there, then we have to bring the patient to the operating theatre to examine it under general anesthesia. Everything is controlled. We have to remove it, try to find the bleeding point, and try to stop it, cauterize it. The area that we always tend to check is mainly at the posterior region, which can be very uncomfortable if the patient is alert. So we try to bring it to the operating theatre. All right. This is just a brief diagram, show the outline of the management. So if they do present with bleeding, stabilize the patient first. If the bleeding is controlled, that means it's already stopped, it's very minimal, we just observe first, followed by a follow-up where we will see and we will put a camera in just to make sure we don't miss anything in the nose. If bleeding is persistent and we can actually visualize the bleeding point, we can actually cauterize and stop it, right? But there's a bleeding, but we can't visualize, not sure where it is. We will pack the nose with the anterior pack, as I mentioned earlier. If it's still bleeding, it goes to posterior packing, and if it still continue bleeding, surgery, right? We have to go to the operating theatre to stop the bleeding. All these cases, we have to admit the patient to the ward. Okay. So after listening to all this, Should I be worried? Should we be worried if we have bleeding from the nose? So ideally, all episodes of epistaxis should be reviewed by your friendly neighborhood ENT doctor, especially if the amount is large. That means a lot of bleeding. Say, wet your whole your shirt and pants, like one bowl full of blood. Especially it's bleeding from the one side, only unilateral, only one side of the nose, or you have multiple episodes over the course of many months, almost weekly bleeding. Those are points that should be noted, and that should make you go and see a ENT doctor. And also, other than bleeding, if you feel you have also a neck swelling, you have weight loss, you have loss of appetite as well, and you have a strong family of cancer, things like that. These are what we call important points. Then you should go and see a doctor to be examined. Okay. And so, what should I do? Right? What should I do if my nose is bleeding? Number one, don't panic. Don't panic. Try to be calm. Perform the Trotter's method, as we showed earlier. And if it doesn't stop, seek medical attention immediately. All right, just go to the nearest health center. They will then refer to us the ENT site. Then we will try to see and identify the cause of the bleeding. Okay. Right. So this is a picture of a beautiful city of Kuching, and this is my colleagues and friends in our department here in Unimas and also Sarawak General Hospital. We're all happy to help you guys. So if there's anything you're not sure, you can ask during this talk and also come and see us in the future. All right. So that is the last slide for me. Thank you very much.
Thank you, Dr. Kevin. So it was very informative talk. So we can summarize that from Dr. Kevin's talk. Don't panic. Don't dance first, basically. Okay,
Yes.
remember the Trotter's method, and then seek your friendly neighborhood ENT doctor. Okay, then we will sort out the rest. Okay, and now just for housekeeping announcement, I just want to remind the viewers that they need to fill in the Google form for attendance at the end of the talk. Okay, please don't put your staff number in the Facebook or YouTube comment box. All right. Now we move on to our next speaker, my colleague, Dr. Lim Lee Yun. She is also a clinical specialist in Sarawak General Hospital and our ENT lecturer in Unimas. She earned her clinical master's degree in ENT from USM and very active in academia. Now I would like to invite Dr. Lim Lee Yun to present the talk. So Dr. Lim.
Good morning, everyone. Thank you, Dr. Anzali, for the wonderful introduction. I'm Dr. Lim. First, let me share my slide. Hold on. Okay. Sorry for the delay. Share the slide. Okay. Now we can see my slides.
We can see your slides now, Dr. Lim.
Okay. So, good morning. So today my topic will be about nasopharyngeal carcinoma. So as Dr. Kevin has already introduced, the one of the most common causes of epistaxis or nosebleed in our Sarawak population is actually one of the causes is actually nasopharyngeal carcinoma. So in my talk, I would like to bring an awareness about this disease. So today, this is my outline of my talk. I would like to this is my outline. I would like to talk about the what is nasopharyngeal carcinoma actually. So what are the risk factor of NPC? Okay, nasopharyngeal carcinoma, we also like to call it NPC. So it's a short term for it. So what are the risk factors? What are the common presenting symptoms? What can I do? And what are the treatment available for NPC? So start off, what is actually nasopharyngeal carcinoma or NPC? So it's actually a cancer that is hard to detect. It's because it's actually at behind of the nose. Even though we say it's nose, but it's not at the front, and you can't see it. It's often difficult to diagnose. So it's actually it's a type of head and neck malignancy. It's an abnormal tumor growth that's situated behind. So this is our nose, and it actually goes way behind. That's the growth behind the nose. It is the fourth most common cancer in both gender in Malaysia. And it's more commonly seen in male than the female. So the males are more affected. It's 3-to-1 ratio. And the most common age group is 40 years old to 60 years old. And the ethnicity that is most commonly affected is the Chinese. It's about 49%. And the next in line is the natives from Sabah and Sarawak, which contribute to about 29%. In fact, actually, there is a study that says that Bidayu ethnicity for native Sarawak is actually the Bidayu community, and 22% is from the Malay community. So what are the risk factors that we can see in nasopharyngeal carcinoma or NPC? So there is a few type of risk factor that we mentioned. There's called a modifiable and non-modifiable. Of course, non-modifiable are things like male. Being male is not modifiable, aged, and ethnicity, and family history. So these are the few things that is non-modifiable risk factors of NPC. Like what I said just now, the descendants of Chinese descendants, especially from if it's from China, this is from the Southeast China, from the province of Guangdong and Guangxi. So they actually had the higher risk factors. It's a genetic disposition of this problem. Then there are other risk factors, which is like a modifiable, which is smoking. There's an association of smoking to NPC, and also ingestion of salted fish that is actually associated with the increased risk of getting nasopharyngeal carcinoma and an infection with Epstein-Barr virus or EBV virus. So what are the common presenting symptoms that will bring us to the suspicious of nasopharyngeal carcinoma? So what are the warning signs that we have is this nosebleed and unexplainable, which is like basically you just keep getting recurrent nosebleed. Non-explainable reason is like, for example, because like most of the time, the epistaxis can be explained by nose rubbing or some trauma or some injury to the nose that you sort of can explain the reason of having the nosebleed, or some rhinitis. There is a symptom. But for these patients with NPC, sometimes it just happens. There's just nosebleed, and it's just not one time, and it's a lot of times. Like it's called a recurrent. That's why we like what Dr. Kevin said. This is also the time that we actually should seek medical treatment, or just to check out the nose. Just take a scope and look at the nose. So in nosebleed, for NPC patients present in 50% of the patient, and in 80% of the patient, they actually have lumps. There's like lumps on the neck. So this is like enlarged lymph node. These lumps on the neck, it's huge. It's usually not huge, but it's usually painless. It's very firm. You just press on it and you feel like it's hard. And it's just there and it never go away. Sometimes you go to a doctor and you get some antibiotic, and after the antibiotic have finished the course of antibiotic and you still feel that the lump is still there, that's the time you should be worried. So that's the time also we should seek for medical attention. So another thing that we would like to say in the warning sign for NPC is actually one-sided hearing loss. As you can see, the close proximity of the at the slide that I showed earlier, the close proximity of the tumor to the ear. So it can actually cause one-sided hearing loss because it's behind the nose and it's next to the ear. So 50% of the patient actually present with suddenly they feel like, hey, how come this ear I can hear lesser than the other. So that's also another warning sign. If you have a hearing loss associated with all the above symptoms, then it's also time to see the doctor. I mean, the other symptoms like nose block, stuffiness, because these are very vague symptoms. Sometimes we do not think that is something very sinister, but usually these are quite benign symptoms. But if there is an association with these above symptoms, then yeah, it's time we should seek medical attention. So other things are like facial numbness, double vision, or headache. So this is one of the patients that we saw in the clinic, whereby you can see that these are the neck, we call it the neck swelling, and it's there, and it has been there for a good few months before she came to seek treatment. And true enough, this patient is the patient of a nasopharyngeal carcinoma. So what can I do? So like what I said previously, besides seeking the consult to our friendly neighborhood doctor, like what Dr. Kevin said, we can also start by stop smoking and a healthy diet. We do not say that we completely stop ingestion of salted fish, because that's like one of the main thing that is in our community in Sarawak, especially where the nasi lemak is also has salted fish. So, but we just reduce the intake of the salted fish if possible. So, and if we have the above symptoms, like what I mentioned just now, please go to the nearest clinic, and we will do the rest of it. So, here I would like to ask, what would like to talk about? What will you expect when you see an ENT specialist? So what because it's quite scary when we talk about scopes, and then how we're going to put in things like what I mean, isn't it painful? So I just want to give a small intro, like what we're going to do in the clinic. So in the ENT or on the doctor's office, most of the time, the ENT specialists or doctors will like to get a detailed family medical history from you, from symptoms to family background. So what we would like to know is actually your symptoms. Like for example, whether if there is a bleeding or there's a nose block, which side, which is the site that usually happen, how long, how much bleeding, like what Dr. Kevin said, we can always take a picture or a video when you experience the bleeding and show it to us to give us a better idea of what you're experiencing. And also any association with any nose block or any hearing loss. And most importantly, please let us know regarding your family medical background, especially if there's any history of and malignancy. Next, actually, we will do a targeted examination whereby we will check the lymph nodes of the neck and also other areas of the neck, especially the lymph nodes where we will just, we will palpate the neck nodes. And the final thing that we usually do is the nasal endoscopy. So as I have to mention earlier, the lesion is not at the nose, but it is situated at the nasopharynx, which means it's at the end of the nose. That's the end of the nose. So we can't see it by using anything that like just you can't just see it just by tilting or tilting the nose or just by shining the torch. No. So we still need to put in a scope. as scary as it sounds, but it's what we have to do. So we have to put in the scope into the nasal cavity and to see whether if there is the lesion. And if there's a lesion seen, then a biopsy will be taken. So this is how we perform the nasal endoscope. So this is what we want to see, the inside of the nose. I think just now Dr. Kevin has already shown you what do you see, the journey into the nose. So usually we will be endoscope guided, and then we will just, if there is a biopsy, there is a mass, then we will take a biopsy. Like for example, this is a normal nasopharynx, meaning that this is the normal view of a normal, there's a normal person, the view of a normal nasopharynx. So this is at the end of the nose. So here is the eustachian tube, whereby it is connected to our ears. So that's why if you all have experience like sitting on the airplane and then you have a sudden nose block, and then what you do is like you close your mouth or you close your and you pinch your nose and then you blow out. That's we call the Valsalva maneuver, and you can hear a pop in your ear. Or sometimes by swallowing or eating, you know, like when you are in the plane and then the nose just got blocked, and then most of the time we drink or we eat a candy, or like in children, we actually encourage for bottle feeding. This is what happened when we open up this area. So why do I say hearing loss? So if you notice that there is a mass for this patient, for this is a NPC, this is a growth, okay, I would say this is a growth in the nasopharynx. So if this growth is actually situated in this region, so it's actually closing up this area. So the balance of the, where we say the equation and all the, when we're trying to equalize the pressure, it cannot be done. So it actually obstructed, and this actually caused a hearing loss. So that's why hearing loss is associated with this condition. So this is the mass that we can see in the nasopharynx. So what do we do when we see this mass? So we will just biopsy. So how basically biopsy, what is a biopsy? So I do not have a video or a picture because I mean that we have a biopsy, but this is the how we take it is. It's an office procedure. Do not be worried. Most of the time, you will not be admitted unless the biopsy taken then it causes a lot of bleeding. Then admission is required. But about 90% of the patient do not require an admission. So first, your nose will be sprayed with the local anesthesia and with the decongestant. So what the local anesthesia do is it will numb up the nose and it will reduce the pain, while the decongestant, it will shrink out the mucosa, those turbinates that we mentioned, and create more space for the biopsy to be taken. So all these lesions will often be taken together with the endoscopic guidance. So lastly, so what are the treatments available for NPC? Basically, after we get the confirmation or from the tissue biopsy that I mentioned earlier, so we actually had we will refer you to the appropriate department. So early detection is very crucial for better outcome because it's logically when you detect early, you get the earlier stage, it is of course better. It always has a better outcome. So once we have a positive biopsy, we will refer to oncology department. But of course, prior to that, we will actually we will arrange for imaging such as CT scan or sometimes MRI. And then treatment for nasopharyngeal carcinoma is primarily radiotherapy with or without a concurrent chemotherapy. This tumor is actually very good response to radiotherapy, and surgery it's not the first line, and it's only reserved for cases where we have recurrent or residual. Recurrent means we have treated the cancer and the cancer came back. Recurrent or residual. So if the cancer came back after 6 months, we call it recurrent. If the cancer came back before the period of 6 months, we call it residual. So what I said about this is actually about the treatment. The earlier, the better. Is because there is a study by America whereby they actually they actually categorize the prognosis based on the how extensive the tumor is. So if the tumor is localized, what does it mean? It means it's at the it's at the nasocavity and the nasopharynx only. It's about 85% of survival, as compared to if the cancer has spread to a regional structure, which includes the neck. That means that when there is a presence of neck lumps and bumps, so the prognosis is actually about 70%. When there is presence of distance metastasis, distance meaning that is like that the cancer has spread to other parts of the body other than the nasopharynx, it actually also have 50% survival. So basically, all in all, NPC is it is quite a good it's not a good cancer, but the survival rate is quite high for this cancer. So we just need to get it detected and treated. So that's all about my presentation today.
Okay, thank you very much, Dr. Lim. It was a very comprehensive and concise talk about NPC. I'm sure some of you are maybe quite scared by this talk, maybe, but don't worry. Let us assess you first if any problems. So we know that there's so many causes of epistaxis. Okay. Now, can we proceed for the Q&A session? Dr. Lim and Dr. Kevin.
Yep, sure.
We have one question from the viewers. I think this would be for Dr. Lim. So the question is tempoyak considered one of the cause of NPC? Dr. Lim?
Yeah, tempoyak. Tempoyak is actually the durian, right?
Yeah.
Yeah, it's a preserved durian. Because I don't think there's a study on that. I'm actually also not sure. Because it's, when we talk about the salted fish, it's actually about the natural somites that's contained inside the fish, basically the preservation. So I guess there should be a study on tempoyak to see the level of the natural somite in the in the preservation, to see whether does it actually contribute as a risk factor. Yeah.
Okay, so we can still keep on eating tempoyak.
But I guess everything it's about moderation. So I guess if you say that, I can't just say that you can eat anything. But of course, like having said so, that eating all these preserved food, it just increase the risk, but does not mean that if you do not eat, you don't get NPC. That's also another message that I think yeah, because it doesn't.
So yeah. So basically, it's the chemical contents of the salted fish. Is that correct?
Yes, it is.
Okay, so that answers the first question. I think there's another question. This would be for Dr. Kevin. It says, my child keeps getting a nosebleed. So when should I bring my child to the hospital, and do they need to be admitted?
That's a very, very good question. If the child is bleeding from the nose, it is better, and the child should be examined by a ENT doctor, right? If the amount is a lot, if you feel the amount is a lot, the blood is in such a big volume that it's even wet his clothes and his pants and shirt and the towel and fill up a cup, you should bring him to the hospital immediately, all right? Immediately, especially if you notice after bleeding, the child looks very weak. All right, that one requires immediate medical attention, you have to bring your child to the emergency department. All right, if you notice the amount is small, child otherwise is okay, and it's all right to get an appointment to see us. So normally, if it's just a minimal bleed, and if we do see the child in the clinic, it will just be a normal clinic visit. So once we see the child, we ask the relevant history, we examine the nose with the scopes, do the full examination, then the child can actually go back, all right? But if the bleeding is a lot, the volume is a lot, the child appears weak, then that might require an observation, probably a night or two stay in the hospital for better investigation, right? So even though most of the time the bleeding amount is lesser, the cause is actually just pretty common causes, nothing serious, we tend to try to investigate and examine better just to make sure we don't miss anything, right? I hope that answers the question.
Okay, thank you very much, Dr. Kevin. So basically, it needs to be assessed by an ENT doctor before you need admission. Is that correct?
Yeah, that's correct. Yeah.
Okay, so we move on to the next question. This is for Dr. Lim. Still about food. How about pekasam ikan? Because this is one of the local food as well. So basically, pekasam is like the fish with how do you say, asam? Yeah. I think that's how I would describe it.
Yeah, actually, I have to Google pekasam because being not a native of Sarawak, these are all actually new food to me, and these are all basically just I know there's a lot of local food that they are actually preserved, which I think my talk has triggered some of the fear. So, but honestly, because that's why I said that we are actually the studies are only showing on this salted fish and basically preserved fish and vegetables. So I guess that this preservation, because most of the time all these preservations are done at home traditionally, so we don't have any ratio on how much and how much to put. It's just our grandmother says that this much lah, so that's how things are. So we do not know what is the level. So back to the same answer, is it's actually the chemical content in it that is actually the risk factor. So if we were to know, I think it's good that maybe that's our next topic for a thesis or a study research on a food, our risk factor in our local Sarawak food to be a risk factor in NPC.
Yes, there would be a very interesting research area. I only know how to eat pekasam ikan. I don't know what is the exact contents. So if it has salted fish, maybe it can be a risk factor. Is that correct? Next question to Dr. Kevin. So the question is, my kid occasionally has epistaxis when he is having a high fever. So is it a normal thing to have epistaxis during high fever?
All right. So normally in patient with fever, there's some infection going on. And in kids, most of the common things are an upper respiratory tract infection or a URTI. So all these infections can sometimes cause bleeding as well. And when they have this kind of infection, they have running nose, they tend to rub the nose, tend to blow the nose. The area that we mentioned earlier, the litmus area, which is very vascularized, a lot of blood vessels there, they tend to bleed as well. But again, going back to what we discussed earlier, kids who have or anyone with any frequent or recurrent bleeding from the nose requires an assessment by us as well. So if you notice your children having frequent nasal bleeding with or without fever, it is better to be assessed just to make sure there's nothing serious going on causing all this nasal bleeding.
Okay, to continue that question, Dr. Kevin, what is the most common cause for epistaxis in children?
The most common cause, the one that we encounter in our clinical practice, is actually just bleeding from the littles area, which is a part of the front of the nose. So most of the time it happens because the child tend to rub the nose and sometimes dig the nose as well. So most of the time it's due to trauma from the littles area, which is the area of the nose which is very vascularized. So when they play or they rub the nose, those are the most area that can be injured and can cause bleeding. So most of the time it's not serious. You just need to ask the child not to rub the nose, and we can do prescribed ointment. We can prescribe ointment that can be applied to the nose to moisturize the area so that it doesn't get injured easily and doesn't bleed easily.
Okay, understood, Dr. Kevin. Next question for Dr. Lim. What is the most common symptom of NPC in the early stages?
Okay, like what I said, NPC is quite it is difficult to diagnose in the early stage. Of course, one of the early signs can be as subtle as a hearing loss, just a pure hearing loss, one-sided, and bleeding. Like 50% of patients presented with bleeding, and around 40 to 50 with a one-sided hearing loss. So it actually also depends on where the mass is going behind the nasopharynx. Because if let's say it's nearer to the place that I mentioned earlier, like nearer to the ear where the eustachian tube is present, then hearing loss is the main the concern. The usually is the first presentation, but most of the time, the presentation of nasopharyngeal carcinoma is at a little bit of a later stage, as because whereby most of the time patient comes in because of cervical lymph node, meaning the lumps and bumps, the lumps in the neck, which brings that to at least stage 3. So that's why we are always dealing with patient at the regional. That there is already has a regional whereby we see the nasopharynx and then there's a regional. So that's why we are always detecting patients at least a stage 3. But I say if you want to detect stage 1 and stage 2, it's unless tumor is situated at areas such as near to the ears, or then suddenly there's a bleeding, the tumor bleeds, then yes, we will probably detect it earlier.
So just to continue on that, Dr. Lim, what if the adult is more than 50 years old and having a nosebleed? So what does that mean? Would that mean like it's most likely NPC?
Okay, a 50-year-old, I presume, okay, gender is not specified. So a 50-year-old with a nosebleed. So like Dr. Kevin actually has mentioned, there are other causes of epistaxis, or not only on NPC. However, if just epistaxis without any other problem, we do not like immediately say this is a nasopharyngeal carcinoma. However, a consult with an ENT specialist is still needed. We still advise because we can still put in a scope, because we always look at the nose. Yeah, we have the scopes to look at whatever to look into the nose. Firstly, is to check whether is there any presence of any lesion, or if there is no lesion, we can even see that is there any blood clot or even the vascularity, or how does the blood vessels behave inside the mucosa of the nose. That will give us a clue on why the patient has nosebleed, because there are also, besides being a regional or a local cause, we also have to look at the patient's other conditions. Is the patient on blood thinners? Is the blood pressure very high? Or is there any other underlying problem in that patient, like in example, any blood disorders, or the patient on TT, or have any underlying other medical problem, which sometimes we detect, usually blood disorders. So I think
Yes.
we do not pin point to nasopharyngeal carcinoma. I think, but you still consult us and we let us figure it out. Yeah.
Thanks, Dr. Lim. So, there's so many causes of epistaxis. So basically, if you're worried, please go to your ENT doctor to get examined. There's a flurry of questions here. Next one for Dr. Kevin. What causes the nasal passages to be dry? And is it advisable to use a neti pot daily? So by neti pot, I guess they mean that it's the thing to
Wash the
irrigate
nose.
your nose.
Irrigate nose, yeah. So what caused the nasal passages to be dry is sometimes due to the disturbed airflow of the nose. One of the functions of the nasal cavity is to actually humidify the air. So if there is a condition in the nose such as rhinitis or sinusitis, the flow of the nose can be disturbed. This may lead to dryness of the nose. And dryness of the nose, especially at the front part, at the litmus area, that is the area that tends to bleed. All right, so if you have frequent nasal symptoms, you have nasal block, you have frequent sneezing, you have running nose, you do drop by and see us. We can start you on some medication, and all this is with the aim of to reduce the swelling, to reduce the secretion in the nose, so that the nasal passage, the movement of the air is better, the air gets humidified, then your nose will be moisture, maintain the moisture of the nose. If it doesn't treat it well, you have dryness, and once you have dryness, any bit of trauma such as rubbing the nose can cause bleeding. Right.
So aircon.
Aircon, yeah. We do have a lot of cases where we ask patients, and some of them say their nose tend to be a bit worse during aircon because it's very dry. The aircon actually dries up the room. Because of the dryness, they have nasal symptoms, blocked nose, and also running nose. This can cause, eventually may lead to bleeding from the nose once they rub it. Things to keep in mind as well, aircon as a device requires frequent maintenance. We have patients who actually found out their filter is so dirty, so whenever they're on the aircon, they have nasal problem, running nose, they have blocked nose, which will lead to dryness, and sometimes after rubbing the nose, then it will lead to bleeding as well.
Yes, makes sense, Dr. Kevin. Yeah. Another food-related question.
These questions are making me hungry.
Our theme for today. Yeah. How about wasabi? Dr. Lim, wasabi.
It's really making me hungry. No, the wasabi is I don't think that's a risk factor. However, there's no study on it. Yeah. But wasabi, I think it's from plants. So having said so, I don't think wasabi has the content of the nitrosomite that we're talking about.
Okay. Another one, Dr. Lim.
Yeah.
So this question, I have had a stuffy nose due to the flu for 2 months, but no bleeding. So it's just that the front of my forehead hurts so much that it almost makes me black out. Sometimes it makes my eyes water all the time. So what should I do?
Okay.
I guess they're saying that is there any over-the-counter medication, or should they visit the doctor immediately?
I think for this question, so he has been you have had a stuffy nose for about 2 months, but there's no bleeding, and there is a pain at the frontal forehead. So of course, it has been 2 months, so it's actually good to check out with the doctor. But if you say that over the counter medication, we can actually, some antihistamines can relieve the symptoms if you cannot get to a doctor as early as possible. I mean, like, probably the doctor is going to schedule you another 2 or 3 days, so you are very having a headache, and you can actually just go for over-the-counter antihistamines. However, I think you still need to consult ENT specialist for this. usually this one, what we will do is we will actually put in the nose, put in the scope into the nose, and the most likely from the symptoms, the most likely thing that you might have is some sinusitis. It's like a sinusitis is the infection of the sinuses in our head and head region, which we actually have frontal, which is over here, and then we have sinus, maxillary sinus, and ethmoidal sinus at this region. So possibility that you might have is there might be a block, retention of mucus, or because of flu, there's inflammation over this area and everything has been blocked. That's why the passage has been blocked. So a visit to a ENT specialist, we will just take a look at the nose to look at the congestion. Of course, what we will do is we will treat you with a course of antibiotics and also some nasal decongestant. After seeing that because if you have high blood pressure, we usually do not suggest nasal decongestant. So then we also can start some nasal steroids spray and some nasal douching. That's the one that you're talking about, the neti pot. Basically it's a douching. It will actually clear out the passage and the nasal passage, and it will hopefully this will reduce the symptoms. And if this is a recurrent, meaning that it keep coming back after these current episodes, and then you keep having it another time, after a few months, then you keep having it back, then probably we might require a CT scan to look at the sinuses and possible surgery if needed.
Okay, thank you, Dr. Lim. Just I think in the sense of the question, I think the questioner would ask also, should they be worried about that? Should they be very worried?
Well, they should be worried because I mean, I'm sure they are worried. That's why they sent the question. But I think it is good to check out to consult one of basically to consult the ENT, because it has been 2 months, and I'm sure it's going to be a very annoying symptoms. So it's just good to just get a consult. So if you said very worried of, like, unless you are worried about malignancy and all, then all the more reason you should just get a consult.
All right. Okay. No problem. Next question for Dr. Kevin. What is your advice on early morning blood-stained nasal discharge?
All right. So if this is a very frequent occurrence, it's been happening for a while, I would suggest and I would advise to be assessed by the ENT doctor. All right. So normally we shouldn't have blood mixed in our nasal discharge, whether it's in the morning or in the evening. So if it's a recurrent thing, it's happening very frequent, that is one of the indication for you to be assessed by the ENT doctor, especially if you have other symptoms, as mentioned by Dr. Lim earlier, any neck swelling, any weight loss, any strong family history of cancer. So all this itself should bring you to see the ENT doctor for you to be assessed with the scope, just to make sure there's nothing inside the nose. All right?
Okay. Thanks, Dr. Kevin. Next one. We have many questions. Okay. For Dr. Lim, does the Faculty of Medicine and Health Sciences provide NPC screening for the public? If yes, what is the procedure?
Unfortunately, it's no, because this I think you're talking about NPC screening. In Malaysia, we still do not have a population-based screening. In Malaysia, we still do not have it. But however, because most of the time we have patient referred for this where they noted that in the blood they actually have this EBV serology that you actually get it like a positive. So this is actually one of the way to have as screening. Not to say that when you EBV positive, EBV serology is positive, you get NPC. No, it's actually a screening whereby we actually scope patients with this serology positive patient because currently in China, the recommendation for their population-based NPC screening, because their NPC is very, very high, their SBC rate is very high, they actually do this serology serology, EBV serology screening. So once it's detected, they will go to the second step. This is the first step of first screen. And then once those who have a serology positive, they will go for a scope. We call it the nasal endoscope, whereby we just put in the scope to take a look, and also the palpation, regional palpation. So, and in cases where there is like a family history of NPC, that means in that family, they has as a family history of NPC, and then a close monitoring of nasal scope will be required. So, so I guess because currently we don't have any guidelines for our Malaysia population, but I think we can adopt to this. We can actually adopt to this current practice whereby if let's say you noted that there's an EBV serology positive, just come to us and we just take a look in the nose.
So what about if they don't have the EPV, they just want to get a scope done, basically? We don't provide that as well, do we?
You mean you just want to come for a scope just to look at the nose? But well, if we don't have the service whereby we go and scope everyone's nose, but if you really feel like you want to have your nose checked, yeah, you can always just pop by for help for a nasal scope to our department. I mean, basically that's not, no, we won't stop that. Yeah.
Okay, all right. Thanks, Dr. Lim. Another one for Dr. Kevin. So my child, 7 years old, had growth like a polyp in both nasal cavity and always leads to nose block all the time. Sometimes makes him difficult to breathe properly. Should I bring him to see the ENT doctor? And then anyway, my child is always sneezing early in the morning.
All right, that's a very, very good question. We always we tend to see a lot of kids like this. As I mentioned in the video earlier, when you see something in the nose shining back at you at both sides of the nose, most of the time it's just a turbinate. So turbinate is just a normal structure in the nose. But in cases where they have rhinitis, right? In cases where they have rhinitis, they tend to be enlarged and becomes bigger. So patients with rhinitis, like what your child is probably having, possibly, they tend to have a running nose. They tend to have nose blocked. They tend to be sneezing a lot as well. Sometimes they're snoring as well. So these are the cases where requires an assessment by the ENT side. We have to assess and make sure there's nothing else in the nose. And if it's just plain rhinitis, we can actually manage and treat them with nasal spray. They tend to respond very well with nasal spray. So a lot of patients, after starting on nasal spray, their symptom improve a lot. So yes, if your child has all the symptoms that was mentioned, it's advisable to bring your child to see the ENT doctor in the hospital, or you can get a referral to CS.
And then how would they get the referral if they are our faculty staff or for the public?
So as a public, because Sarawak GH is a specialist and a tertiary center, you need to get a referral from a clinic, from a polyclinic. So from there, they will give you an appointment to see us in the hospital.
Okay, thanks, Dr. Kevin. Another food related again, Dr. Lim. So, dried longan, dried red dates, and other dried herbs, which are widely used in Chinese herb soups, Is it one of the risk factors as well for NPC?
Mm. Just now we have Japanese, now we have Chinese, then before that we have all the Sarawak local delicacies. So currently, I think all the dried longan and breadits, they are all dried, dehydrated food. I think when we mention about the food, the salted fish is actually the preservatives that we use inside the that is the one that causes the that is the risk factor. So when if these things are dried, like dehydrated, usually I don't think it causes any. I mean, so far we do not have any study in regards to this. Yeah.
So there's a lot of areas for new research now uncovered by this talk.
Yeah. So we have a lot of food that we can venture into. So Malaysia, this is just part of the food, I guess.
Okay, Dr. Kevin, one viewer said, "Good morning, doctor. I have some issues lately, having stuffy nose and feel like runny nose too. But when I try to clean it, it does not have any discharge. But after 2 to 3 times of nose blowing, I found the discharge is yellowish with blood stain. Yellowish discharge. So is it dangerous?"
Another good question. So I think Dr. Lim mentioned as well. So the symptoms that you have, stuffy nose and running nose, and when there's not much or little nasal discharge, all this could point to a few possible causes which we could identify after we assess the nose by putting a camera into the nose. So one of the causes of epistaxis is actually they call it violent sneezing or very strong blowing. I myself sometimes can hear my neighbor sneezing as well. So those are very strong sneezing and strong violent nasal blowing, which can actually injure the blood vessel in the nose and cause bleeding, right? So coming back to your question, if you have all these symptoms as well and it's actually bothering you, there's a lot of studies where they found out nasal symptoms, as simple as running nose or nose block, facial pressure can actually affect your productivity, affect your daily living, which I feel is quite sayang because it can be treated and managed after an assessment by ENT, and most of these patients respond very well to the management that we give. So if you have all these symptoms, I would advise you to get a referral, and you can actually have a look into the nose to see what we can help you with, and hopefully it can help and manage your symptoms. Yeah.
From the same person, Dr. Kevin, it says, he or she says the discharge is like a blood clot. It's just the color is yellowish and blood stain.
I see. Like a blood clot but yellowish, like a blood stain. So things like this, it's sometimes hard to visualize from words. So this is where technology comes in handy. If these things happen again, I would advise you to snap a picture with your smartphone, get a referral and see us, and actually show us a picture as well. So anything like I mentioned, bleeding from the nose, especially for an adult, get the referral to see us for us to assess, to see better, to actually identify where is the possible source and possible cause of this symptom.
Okay, all right. There is the question that you answered earlier, Dr. Kevin, from the viewer. Dr. Lim. Dr. Lim answered before. The viewer said, "Yes, doctor, I'm very worried. I have high blood pressure also." I think that's the person with the stuffy nose for 2 months.
Yeah.
So I guess if they are very worried, they should get a referral from the polyclinic or from our staff clinic to get to see us. in Sarawak General Hospital. Is that correct?
Correct.
Yep.
Yeah, I think yes. That's the only thing because like you said, if you just like if you didn't mention to me there's high blood pressure and you just go over the counter and get some decongestant, that will be that's not very nice. Yeah. So I guess just come to us. We will help you. Or if you're not in Sarawak, go to the nearest healthcare facilities and they will probably get a referral from there.
Okay. Again, now, Dr. Lim, there's this question. How can stones be in the nose? Yeah. She said the doctor took out a few small stones in the nose. Can it happen again? So I guess this is, don't know this is an adult or a child. So can you please answer the question, Dr. Lim?
Yeah, assuming that this is an adult. Because if it's a child, we might have to suspect that the child keep putting stones into his nose or her nose. So knowing it, if it's an adult, most of the time these stones that we mentioned is actually crusting or mucus that has been dried out, and then it causes the stuffiness of the nose. So can it happen again? Yeah, possible. So if actually if it happens, so most of the time, I don't know why is there so many pieces of small stones. My assumption is actually crustings, where there's actually mucus and then it just where they dry up and then they just cause this nasal blockage. So uh if it happens too frequently, so probably we may need a CT scan to look at the structural side of our nose. The possibility is the passage of the nasal passage, the normal passage, because our nose is like constantly secreting mucus. So possible is the passage of the mucus is actually disrupted, that causes the stagnant of the mucus and subsequently leads to all these things. So yeah, we might need to do further if it keeps happening. We need to investigate further. Any one of you have anything to add to this question?
Yeah, I think that's a good point. Yeah, really from the crusting and causing nasal symptoms, and if it's not treated accordingly, then yeah, it might tend to reoccur again in the future.
Okay. Still a few more questions. I think we will do the Q&As until about 9:30. Okay. Another question is, doctor, is it normal in the mornings when it is cold, you get the runny nose and then a lot of sneezing? And is it safe to use the nasal spray? There's an example, Rhinocort nasal spray for Dr. Kevin.
Okay, so it's when the weather is cold in the morning, it's normal to have a bit of a nasal symptoms, a bit of blocked nose and runny nose. But if it's happening frequently every morning and even some last to the morning to the afternoon, one of the possible causes could be a rhinitis. That will require you to make an appointment to see us. We'll start you on some nasal spray, all right, after an examination. So patients with rhinitis, they have nasal block, they have running nose and sneezing, or those with sinusitis, with facial pressure, congested nose, these patients, we normally start them on nasal spray, and we normally start them on long-term nasal spray, right? So it's okay to start them on long-term nasal spray, but it's important to see what kind of nasal spray. That's why it's imperative that the nasal spray is started by an ENT doctor, because there are certain type of nasal spray which is only for short-term use. Those are the vasoconstrictors nasal spray. We do have cases where we have patients coming in to us who, when they buy over-the-counter nasal spray, and instead of getting the steroid nasal spray, which we normally start patient for the long-term use, they are given those vasoconstrictor nasal spray, which normally should only be used not more than 5 days. So if they use this for the long term, they come in to us with very severe nasal symptoms. We don't respond to normal medication. So I think the important point is to make sure to see a doctor before you start on the nasal spray, because it's very important to see the content of the nasal spray. Right, it's not just to buy the over the counter, not too sure what it is, and use it for long term and cause a lot of complication in the future. For us, normally patients with rhinitis, with sinusitis, we do tend to start them on a steroid-based nasal spray, which is safe and can be used for long term.
Okay, thanks, Dr. Kevin. So, long term and short term, I guess the decongestants is only for a few days, right? And
Yeah, for a few days, correct.
Steroid one can be few months to few years.
Yep, that is correct, Dr. Anjali.
Okay, all right. We have the viewer reply. It is for the Dr. Lim's question. The viewer replied, "It is really stones when the dog took out from the nose, and it is an old woman."
Yeah.
So I guess
it's
have an idea.
Yeah, it's actually there's a condition we call the rhinolith. So yeah, rhinolith is actually a condition where there's actually sort of we call it stone formation. Because just when we talk about this, cause of the rhinolith can be by the mucus, like what I said just now, stagnant mucus, and also sometimes there is like a foreign body. I'm also assuming can also be fungal. So basically, all these patient is they are symptomatic. They came in because they have nose block, false smelling, meaning there's some very smelly coming in the nose. So when we take a look, and then there is something there. So the treatment is actually easy. That we actually just hook it up, but it's quite painful because it sometimes stuck to the mucosa. And yes, it might recur. And I guess one of the way that can prevent it from happening is nasal douching. Of course, besides the just now that I mentioned, is to do a scan to look for any abnormalities of the nasal pathway. But at the same time, of course, there are some patients who doesn't want surgery, can actually do a nasal douching, whereby that's where we talked about the neti pot earlier. That's where we put some salt solution and we just clean the nose daily. It's actually harmless. It's not steroid spray. It's not medicated. It's just macam cuci lah. You just wash the nose. Yeah.
Okay, so I guess this condition is quite rare, if I'm correct, right? And it's
a very rare
pretty
condition.
harmless, right?
Yes, pretty harmless. Just that
Okay.
very discomfort, a lot of discomfort.
All right, thank you, Dr. Lim. So that is the last question. Just wait a minute. We'll check in YouTube. So no more questions in YouTube and Facebook. So I would like to thank both of our speakers today, Dr. Lim and Dr. Kevin, for their very informative talk and for being very knowledgeable in answering all the questions asked to them. Okay, just a reminder as well before we end the talk. For the viewers, there is the QR code will be shown later after this. Okay, to get your CPD points, the QR code for the Google form. Okay, and then with that, I bid you farewell. Thank you, and Assalamualaikum warahmatullahi wabarakatuh. Thank you all.
All right, bye-bye. Thank you all.
Thank you. Bye.